Hi, everybody. It's Professor Miller. I hope everybody's having a great week so far. I wanted to provide a quick introduction video to Module 2 and give you some information or background to some of the stuff that I have posted. I'll also go through the innovation form for the assignment for this module and kind of give you, a general understanding as to what to look at for it. So with Module 1 that we just kind of finished up, we looked at general introduction to like the U.S. healthcare system changes, an introduction to policy. So with this one, we're going to look more at kind of a twofold area, looking at evidence-based practice and outcomes and care, as well as APRN professional implications with health policy. The one assignment more focuses on innovations in care and looking at like outcomes in care, because that's a big area that you will come across now. When you think, at the healthcare system, we have all these changes and we've kind of shifted from fee for service to more of a value-based care system where everything is based on outcomes and care. Another issue too, like which I'll talk about in a moment, is a lot of the nursing care that we provide is not measured great. So that's why it's really important to be at the table and making sure that we're measuring outcomes that nurses are providing and advanced practice nurses as well. But I'll briefly talk to you about that as we move through some of the documents. I do have a lot of different documents on here, and they're not meant to be inclusive, like you have to do every single one of them. That's why I thought it'd be good to post a video to kind of direct you with what you should potentially look at. And some of them are good ideas too for like your policy analysis. Like it's just a good way to browse through different topics to kind of get you thinking. I did add that form on here, so if you do want to discuss topics or if you're still looking for group members, if you still are looking for a group member, you can obviously reach out to me and then I can coordinate this as well. So obviously you feel free to use that form, as needed. This first section of documents, I have more information on APRN practice and current recommendations. And I know I briefly mentioned or tied in the Institute of Medicine's Future of Nursing recommendations within our first module. But I really want you to start thinking about this and how the implications for your specific practice area. And it's the same thing with forensics. This is an upcoming area. And honestly, a lot of forensic practice will be very similar to like an NP practice. So really think about it. Even when I post, NP documents, think about it from the perspective of forensics as well. So I did post two different documents, one related to strengthening forensics, the Institute of Medicine. So looking at those recommendations from the Institute of Medicine and how does it apply to forensic nursing practice. And really, that's what you should start thinking about because those are the areas that you really want to start advocating for within your profession or specialty area, essentially. Where do you want forensic nursing to go? How should it be integrated? Because obviously, there's a lot of potential with nursing in general, and it being integrated within our systems. AANP, Institute of Medicine, same type of thing. The response from the American Association of Nurse Practitioners and how we meet those recommendations or how we can meet them, essentially. I did add the consensus model for APRN practice. When we talk specifically about APRN practice, we're looking, this obviously relates to NPs, but it could be midwives, it could be CRNAs, etc. What this is essentially is a recommendation that we have more consistency across the United States in terms of our licensure, accreditation, certification, education, meaning that we shouldn't have this variance between the state of Michigan versus other states. Because if you look at practice, specifically NP practice, it's very different from state to state. Some states have complete autonomous practice, some have restricted practice. So it's just to get you thinking really about how it really should be, more of a model that's the same across all states, essentially. So that's what the consensus model is and kind of driving towards that. And the other area too is, right now, obviously with NP, you can have a master's degree or you can have a DMP. So it's looking at kind of making all those areas the same across the board. So I just try to introduce students to that so they have an idea as to what it is. I added role of NPs in reinventing primary care. It's just a good article to kind of browse. And nursing in the primary care shortage. So once again, the nursing role, we really have to think outside that inpatient perspective and start thinking about our role in the outpatient perspective or how we can improve health outcomes, outside of chronic care or acute care. It's more about preventative health and, health promotion and stuff like that too. So it's kind of re-envisioning the role of nursing essentially. You will see that throughout different modules, I will add, specific videos that will discuss things like prescriptive authority, which I have on here, which is Michigan. Like I mentioned, everything's a little bit different. Um, so just take a look at that. It just I go through how how prescriptive authority is kind of regulated within Michigan and kind of where our practice stands essentially with it. And these are just other documents that you can look through with it. Advanced practice scope of practice. Once again, I have our general nursing scope of practice, which I'm sure you've all have read at one point or looked through before. So that applies obviously to all nurses. And then I did add the forensic nursing and then the APRN NP scope of practice as well. So those are good things to look at and really think about it too. What areas do you feel like, there's areas that you could attend, work on or provide innovative practice changes to basically practice at the top of your scope of practice. And that's areas that we really want, nurses to start doing is practicing at that top of their licensure essentially. So look at, what direction do you feel your practice should be going essentially. And that'll kind of help you think about areas that you should advocate for too, in terms of your practice. Once again, I did another video too. It's on NP certification and more of our scope of practice because it is very confusing in the state of Michigan. So if you're, an NP student, you may want to look at that. Or even for forensics too, because honestly, eventually your practice will be very similar and it'll be more autonomous essentially. So it's always good to take a look at that stuff too. I did have a video on collaborative agreements because we do have, when you look at prescriptive authority and autonomous practice in Michigan, with HB 5400, we actually kind of do have autonomous practice, but there's snags along the way with Medicare reimbursement and controlled prescriptions. Medicare reimbursement will require you to have a collaborative agreement for billing purposes. Same thing if you want to write controlled scripts, you have to have a collaborative agreement with a physician. Other than that, we truly, and as an NP, you can actually be very autonomous in Michigan. But there's little snags along the way, like with the Medicare reimbursement. And those are things that we need to be advocating for and working towards solving. Collaborative agreement, just frequently asked questions. You can just browse that. Evidence-based practice. Well, this is areas that I want you to kind of think about too, because remember how I mentioned things are very outcome-based now. We're moving away from fee-for-service. We're moving towards outcomes and looking at outcomes in care. And that's essentially how payment is derived. So that's why evidence-based practice obviously is so important because we need to be providing care that's based on evidence that's improving outcomes. I did add USPSTF preventative care guidelines. Once you move into your clinical courses, especially NP, you will become very, very familiar with this. This is truly what drives a lot of our practice. If you go to the website, you can look through breast cancer screening, colorectal screening, aspirin prevention. I mean, literally, there's a ton of different guidelines that you can go. And what it is actually experts in public health and physicians and even nurses are on the board. They look at the rating of evidence or the grading, I'm sorry, of it. And, they'll rate it like A, B, C, or inconclusive. And I kind of go through that in the video as well. But with changes with the Affordable Care Act, they're actually all A and B are supposed to be provided, or I'm sorry, covered through insurance companies. But this is all about preventative care, and that's what we're moving to, obviously. And it applies to forensics once again, because there's screening tools in there and there's screening guidelines that we need to be implementing. I added sexual violence spectrum of prevention or sexual assault kits just to get you thinking about different areas of practice or like an innovative implementing like an innovative type program or something like that. Same thing, national standards from family violence. I added that on here. Evaluating outcomes and transparency is another really important area, like I've already kind of mentioned. Once again, we need to be looking at the outcomes and care that us nurses are providing and making sure that it's reported and even looking at data. That's why now we use health IT and a lot of data to look at outcomes. Well, it needs to be tied back to us as nurses. And that's kind of the problem too. Like when we look at billing under a physician, it's not recorded under us. So it's just something to kind of think about. But Making sure that we're looking at outcomes and that we're actually evaluating the care that we provide as nurses or advanced practice nurses. This is just an area I added this because it talks about like different process improvement and changes, and basically what would you measure as an outcome. It's just areas to kind of get you thinking. Like if you're trying to figure out like an area that you want to write about for the forum, it might kind of give you, spur some ideas there with it. So you can just take a look at that. These are all supplemental journal articles as well. Flexible healthcare, flexible regulations. That's more about our practice because once again, the more providers or types of providers we have, it actually it's like increasing that pool of providers. So there's more. How do I say it? More options, which actually will drive down healthcare costs, if that makes sense. So that's what that's about. But that's like a reason why, another reason why NP practice or advanced nursing practice should be supported too. Um, these are NP talking points. These are from the Michigan Council of Nurse Practitioners and AANP. But it talks about reimbursement. This is actually a good area. Like if you were doing a policy analysis on autonomous practice or a certain scope of practice issue, these are areas that you use to back up your statements. Everything that you are advocating for or trying to implement, you have to basically have evidence to back it up. But these are just good, quick, concise documents that you can take a look at. And they're actually good documents to use for like a policy analysis if you're doing that area. Same thing, the initiatives and guidelines, that one too. These are just good areas to think about for evidence-based practice. I added two other things too, like key to disaster preparedness, a community response to domestic violence. So those are things you can think about like an innovative practice change. I just added this dental to primary care. It's a good example as to how our system is changing and really working together like in an interprofessional team to achieve better outcomes essentially. So it's just a good read to kind of put it in perspective. In terms of the assignment for this, I did try to put in here about, like objectives and trying to, look at areas what you should think about with this. But like I mentioned at the beginning, module 1, we kind of looked at healthcare transformation and advocacy, from a broad perspective. So this module, we're taking a look at APN practice, and then specifically actually at two areas of health policy. I want you to really think about policy in terms of your practice as a clinician, and then the other one being health policy as it relates to population health or patient outcomes, essentially. So really, I want you to think about it from two different areas. The assignment focuses on population health or patient outcomes. But I'm going to post another reflection page, and I'm not going to make you write on it. I just want you to truly think about it because it's really important to think about that in terms of advocating for your profession. And I'll show you that in just a moment. So we're basically looking at health policy and how the implications it has on patient outcomes for a specific population, essentially. And over time, all this becomes natural, really, as you integrate, as you're integrated within the healthcare system as an advanced practice nurse, you really start to notice these changes and what you can do to improve it. But we really have to think too. You have to consistently evaluate the guidelines that you are utilizing in the policies that you're providing care based off of. So we really got to think about this, when we're practicing. So I want you to identify a topic of your choice as it relates to both health policy and patient outcomes. And this can be very, very broad, from a very broad perspective at like the systems level or state, federal level, or it could be something very, very specific within like at the unit level or patient specific patient population level. And I let you guys choose the topic of your choice because honestly, it's what keeps it interesting and everybody, contributing. You learn from each other, doing activities like this. And I did different discussion threads that you can branch off of. It's not inclusive. It's just I just posted them for ideas. So you only, obviously at the bottom, you'll say I have all these posted, but you only pick one, obviously. You don't need to answer all of these. You pick one area and post it under the one that it fits best under. So when you're doing this, think about things like the background issue, general background factors. So what is your topic? You don't have to do an extensive literature review. I want you just to browse the literature so that you know what the issue is and utilize that literature to basically support your discussion topic. What is the issue? What's not known about the issue, or what is known about the issue, and why is this significant? And if you're recommending changes to like a current practice guideline, like use that literature to support the changes that you're recommending. So basically back it up. Or why do you feel it needs, to be changed? It could be anything from, discharge from the hospital or changing the way that we manage a chronic condition. And I'll give you more examples in a moment. But identify any health policy rules, regulations, or guidelines that are currently in place. So, what is there anything that's currently in place? If there is there a change that's needed? If not, what are your recommendations? Do you recommend that the guideline be in place, or do you recommend a policy? Um, and basically, if not, obviously, then what changes would you recommend for that policy or guideline? Obviously, we're looking at supporting patient outcomes. How does your practice as an APRN fit in with these recommendations or help mitigate the problem or attempt to provide a solution, essentially? And then obviously just conclude with final recommendations and outcomes you wish to receive. So what kind of outcomes are you looking at with this? I do have it open for posting until October 10th. And then I usually always add the 5 days after. However, I know I posted this like a day or two late. So if you guys need until like the 11th or 12th, that's fine with me. But obviously, the earlier you get it posted, then other students can respond as well. In terms of response, just do 2 other students. You don't have to respond to every single forum, but do 2 other students' postings and then any comments off of your original. These are just examples. When you're posting it, though, try to post it under one that it's most pertinent to, like integrated healthcare teams. These are examples, like a federal health center where they integrate multiple services, like they might have psychiatric mental health or within, like a primary care facility. Transitional care is a huge thing that's, up and coming as well. We've done a lot of transitional care for the elderly population with chronic conditions. But the same thing, developing a transitional care model for kids with chronic illness. Care teams for sexual assault victims. So anything that would integrate an interprofessional team or a team that would, provide care or increase outcomes for patients. These are just ideas. Older adult chronic care. These may be specific guidelines and maybe your guidelines related to end-of-life care, palliative care, evidence-based practices. There's tons of topics for this. It could be preventative care guidelines or specific guidelines that are used for a certain diagnosis like hypertension, CHF, or even the evidence-based guidelines that you utilize within forensics. So basically think about how you would implement this or what do you feel needs to be implemented. Quality of care, this could look at things like health IT, basically looking at like EMR and documenting, gathering data from EHR. Same thing with EHR regulations and tracking, quality care measurements. Those are things that you can look at as well. Public health topics, this is an area that a lot of students tend to do. There's a ton of areas, once again, that you can do under this. It could be things like lead level screening in kids, immunizations or policies surrounding immunizations. Like I mentioned at the beginning about the one with the health department, like that's just an area that, they implemented and to help solve reduced rates of immunizations in certain counties. So it's things like that that you want to start thinking about, like how can we solve an issue? EpiPen policies within the school setting, newborn screening and how it's done, forensics, there's tons of ideas here. But basically any public health topic can fit under this. So, if it's related to populations, you could probably just put under the public health. So that's what this assignment is for, our Module 2. I added this. You do not, I know I have this on here, do not have to write about this. I'll erase those dates. But these are areas, like I said, I want you to think about. Think about your scope and standards of practice and the current Institute of Medicine recommendations. And I really want you to think about, your current practice and how it fits in with like the Institute of Medicine recommendations for forensic nursing. Because really this is what we should be striving for in terms of how we practice as an advanced practice nurse. So basically how does it align with these recommendations? And then even identify areas that you feel are important to advocate for. And in order to support continuous professional growth. And these may be things like certification, education, licensure, uniform regulations, like certain certifications for forensic nursing. Same thing with nurse practitioners. Think about the consensus model and how I mentioned how we really want of uniform practice across the United States. And what's the significance of that for the APR or for APR in practice? And how does our practice within Michigan compare to this? So really think about when I mention the consensus model, really think about the regulations, not necessarily. I guess the education is important too because I have a mix now between MSN and DMP, but really think about regulations like independent practice, collaboration, prescriptive authority. And I just really want you to understand what our practice is in the state of Michigan. And I did post some videos on there that will help you understand that a little bit further. You do not have to post on this. I just added it in there so you can think about it. And I did go through most of the discussion forums. They're all great. I'm going to try to get them posted within the next couple days. I try to give a good amount of feedback to students on, individually when I grade things. So I do want to make sure that I have everything done, and then I'll get them posted as soon as I can. But everybody did well, so no concerns. If you have questions, obviously feel free to reach out to me, and then I would be happy to help. I will talk to you guys soon, and I hope you have a great weekend. Thanks.